But now we're finding out, thanks to studies, that even if you are sitting in a chair, and I'm guilty of this sometimes, I'm sitting in my chair for 6 hours at a time, and I have a standing desk, and I don't always use it.
Correct.
But is it fair to say that part of the problem when we're now talking about job is now more than ever the sedentary manner with which we approach our job, basically sitting on our butt all day long?
That's right. That's right. So sitting down for a prolonged period of time, that can affect your lower back. And I tell the patients to every now and then to stand up and walk at least half an hour, 45 minutes to stand up and walk around, and that way you are not putting a lot of strain on the lower back by doing so.
But it just seems that people will say, but wait a minute, I'm sitting. What's the big deal? How can it hurt my back?
Normally when you're seating, what happens is that you're putting some strain on the disc, which are these structures that we have in the back. So we have the bones, and in between we have the disc. So when you're seating, you're putting more pressure on those discs.
You're compressing it.
You're compressing it. So and part of aging, the disc will start degenerating. So if you're sitting down on a disc that is already weaker, to put it that way, is more prone in having people developing injuries there. And that's when what we call the whole cascade of having back problems starts. Normally starts on the disc start degenerating. Then afterwards, it will start affecting some of the joints that we have in the back, which are called the facet joints. And all of a sudden, then we start putting some pressure on the nerve, which are these yellow structures. And some people, they start having sciatica or another condition called spinal stenosis, which is narrowing of the canal. So all those things that they normally happen one after the other one is just like a cascade of events.